Oh, here we go. All right, everybody. We're going high tech here at the Healthy Dog Expo podcast. We have our first intro. So, welcome. And I'd like to welcome our guest for today's podcast, Dr. James Anthony. Dr. Anthony is one of the most credentialed veterinary dentists that I believe in the world, certainly that I've ever encountered. He's been a pioneer in the field of veterinary dentistry, has practiced for 40 years, has taught all over the world, has been a professor, and now is on a research mission and spreading the word about proactive dental health for our dogs. So welcome, Dr. Anthony.
Thanks for
How are
asking
you
me to come
doing
and join
today?
you.
Oh, I'm
I
so
am
excited.
wonderful,
And
thank you.
I know my people are going to be happy because they've been asking for you. And since you were on the Inside Scoop with Karen and Rodney, your name has
Yes.
it keeps coming up and coming up. So I'm so grateful our schedules can work together. And I see we have some people popping into the room. Hi, guys. Happy Friday. I think this is our first Friday podcast. Please drop a note in the comments to let us know you're here and where you're watching from so we can be sure all our tech is working. So far, it's looking promising, but I never want to jinx us. And Dr. Anthony was letting me know, oh, Eric, hi, Eric, and hi, Julie Lynn. Dr. Anthony is up in the wilds of Canada where it's actually not that cold for a change comparatively. You said it's like 38 degrees Fahrenheit, whereas before you were
Yes.
well below freezing. We
About
had
a
a
week
heat
and a half
wave in
ago.
a week and a half. It was not pretty. Hi, Deb. Hi, Janet.
No.
Janet is one of our admins, and she'll be helping us dropping links in here, there, and
Great.
everywhere. So it looks like the room is filling up. So we were chatting a little bit off camera about what we really wanted to be sure to emphasize. And one of the things that was most interesting to me was dental pain in our dogs. Can you share some insights on why a dog might have a painful mouth or signs we might see and all sorts of related things to that?
Absolutely. Dental pain is very, very common once it's established, meaning that if we have an early disease process in the mouth, it can be an extremely uncomfortable event for the animal and can affect it a lot, from just paying attention to commands and whatnot, to retrieval of balls or whatnot, because it hurts to open the mouth and chew or that. And also just normal mastication, eating can be very difficult. But that's the worst of it. A lot of the dental pain is usually associated with other diseases that can basically affect other organs of the body and cause other problems long term. Dental pain in the mouth, it can be as simple as breaking a tooth or chipping a tooth. And as a result, just that alone can be a lot of discomfort. I don't know if you've ever had an abscessed tooth or a root canal where you had to have a root canal treatment. Very, very painful. People bang their
Unbelievably
head
so.
against the wall and hurt so much. Same thing happens in animals. And basically, the dog is in extreme discomfort, but can't vocalize what is wrong. And that's where you looking at the mouse, seeing that, oh, something doesn't look right. I should bring it to my veterinarian for them to look at and letting them diagnose the problem and how to treat it. The the most common one, and which is probably unanimous around the world for pets, is basically periodontal disease, gum disease. Advanced gum disease is extremely painful and uncomfortable,
Mhm.
from chewing to biting things, and also basically causing the inflammation there and the gums being so red. They're each time it chews, it could bleed and also spread other inflammatory byproducts throughout the whole body, leading to other diseases as well: heart disease, kidney disease, liver disease,
Mhm.
Alzheimer's, diabetes mellitus.
Mhm.
The list goes on. I mean, there's been a tremendous association. Now, I like to just take one moment and mention these diseases will not just occur if you have periodontal disease. There has to be other factors contributing to it. As
Mhm.
a result, it's an association. It's not a direct cause and effect. So, in other words, if you got periodontal disease, doesn't mean you're going to get heart
Right.
disease.
Right.
There's a good chance it can long term. However, there's other factors that come into play that cause the problem. Okay. So with dental pain, even just a malocclusion, abnormal
Oh,
malocclusion,
excuse
where basically a tooth is hitting the roof of the mouth or something like that, and the dog each time it chews,
Mhm.
it hurts. So I mean that can be an.
Mhm.
Otherwise, there's a lot of autoimmune diseases in the mouth that cause severe ulcers and discomfort that way. Cats have a condition called feline stomatitis. There's many facets of that, and it's extremely debilitating
Yeah.
for those cats.
Yeah.
Dogs have something very similar called PUPS, and it is extremely painful for those animals. And a lot of times it's an autoimmune or basically a reaction to plaque. Plaque is that little filament you feel in the mouth when you wake up in the morning
Mhm.
and brush it off with your teeth or by brushing. And unfortunately, most people don't brush, and as a result, that plaque retains, and as a result, eventually leads to periodontal disease.
Mhm. Lately, I work part-time at a clinic. I've had a rash of carnasal tooth abscesses. And those dogs, of course, present the carnasal tooth being the large molar that we see towards the back of the dog's mouth. And they will be swollen all the way up to their eyeballs. And those dogs are in agony.
Mhm.
Sometimes there's a visible tooth
Absolutely.
fracture, sometimes not. What's your experience with carnasal teeth?
First of
Abscesses,
all,
I should say.
the carnasal teeth are actually the fourth upper premolar, the first upper
Mhm.
molar, and the lower first molar. So there's three teeth on each side that are considered the carnasal teeth. Okay, and
Mhm.
one or all of them can be involved, or something in between.
Sure.
Usually, it can be as simple as just even a chip off that tooth where we have dentin exposed. Dentin is the material just underneath the enamel. Enamel's the outer covering, the hardest material in the body. Dentin is the same consistency as bone, strong, but it also has basically nerve endings, blood vessels in there as well. And that's why if it's exposed, it can hurt. Even hot and cold, that can hurt. And a lot of times we put sealants on them, or sometimes if it gets infected, we do a root canal procedure on them.
Mhm.
But the most common one that most
Mhm.
people see is because it's really painful is when there's a fracture of the tooth. And that fracture, if it has pulpal exposure, is extremely painful and needs to be addressed. I mean, basically, any fractured tooth should be addressed for that matter.
Mhm.
And with basically a pulpal exposed tooth, that is not just, it's more of an emergency because that needs to be taken out of pain, that animal. and
Yeah.
treat it properly so it doesn't get infected. And actually, there has been cases where infections of those teeth have spread through the whole body and caused septicemias,
Yeah.
and animals have died. I
Yeah.
mean, I
It's
wrote
nothing
a
to do
paper on
around it.
a killer whale that had one and died. It's all from just dental disease, from a fractured tooth. Simple as that. And even people die from fractured teeth if
And
left long enough.
yeah.
And that's why it's always important for owners to look at their pet's mouth and know what the normalness is. And then if there's notice something abnormal, you should bring it to the attention of your veterinarian.
Yeah, definitely. My own dog had a slab fracture, meaning he took a kind of a slab or slice off the outside of the largest of his carnasal teeth. And the poor dog was in agony. And the relief I saw after we removed the tooth was just unbelievable. But I want to
Yes.
jump on something you said, and I'm surprised the comment section isn't lighting up with questions. You worked on a killer whale.
Yes.
Did I hear you correctly? Tell us about that, because that is
Well, I've worked
fascinating.
in uh, I've done some work on killer whales doing a root canal. I can't say which aquarium it was, but because of confidentiality. But yes, I did root canals on some of them. I'd also in the wild, if they washed up on the shore, we want to find out why they died. Was it
Right.
toxicity? Was it starvation? Or what? And the
Yeah.
one that I wrote up was actually basically a fractured tooth that caused the animal's death.
That must be just
So,
a awe-inspiring experience to work on an animal of that size and nature. Just
well, it is,
mind-boggling.
especially when you cannot anesthetize them. You
Mhm.
cannot anesthetize them because basically the pressures in their blowhole, there isn't anything that we can put into the blowhole to inflate
Oh.
the lungs and use.
Oh, wow, I
So
hadn't
we
thought
have
of
to use
that.
local anesthetic, and also we have to get the trust of the killer whale.
Mhm.
So you have to basically be introduced to the whale. You have to go through all the actions of what you're going to do and all this, mimic all the sounds so that they don't get surprised. Because I got to be honest with you, you feel like a fly in front of a frog with a killer whale. With their wide open mouth, they can just eat
Yeah,
you whole, basically,
yeah,
if
and
they wanted to.
and definitely respect the confidentiality of all of our veterinary work. We are held to the same criteria that a human doctor of any type would be. And let's not go into the ethics of keeping these animals in tanks because that's irrelevant to our discussion today. But yeah, the role that cooperative care training plays in doing medical procedures on wildlife of all times that kinds that are kept in captivity, that's just amazing. And I'm going to have to find a cooperative care expert to talk about that sort of stuff because the people who train those animals make our dog training look really bad because they can teach a killer whale to tolerate a dental, and I have people who can't teach their dog to sit. So anyway, my soapbox. We all need to strive to do better. Um,
Well,
so
just
go
wanted to
ahead.
just wanted to go back on that fractured carnasal teeth
Yes.
as to what's the most common cause of that. The most common cause of it is usually from the dog chewing on something hard.
Hmm.
And usually the chew toys that are given to them by their owner are the culprits. To give you an example, uh, antlers.
Hmm.
Dogs love them because it's a protein, it's keratin, and animals love it. However, it is so hard. I have yet to see a dog that has not fractured a tooth by chewing on antlers. Not even one. And people that are giving cooked bones, they're very hard and they will break teeth. Best bone to do is a raw bone, and basically just the knuckle, the knuckle bones of them,
Sure,
and you
those are
leave it
great.
down for about 10 minutes, 15 minutes, and then take it away because then all the nutrition is gone, and that's when the dog starts trying to really get to that last little morsel in there,
Mhm.
and that's when they break their teeth.
Yes, and
So
remember, you
that's the
heard it
most
here,
common
a
cause.
raw bone. We love it. I think it's really important to match the bone size and shape to the chewing style of the dog and the dog's facial conformation. You know, a Labrador and a Shepherd are going to chew totally differently than a Frenchie. And as you pointed
You
out, short-term chewing, and I would add, and I'm assuming you're there too, supervised chewing. Don't give your dog a bone
Yes.
and leave the house. You
No.
know,
No.
no, no.
Not at all.
And and control it. And to bring up training again, teach your dog to give up their bones. Because I've
Mhm.
had owners bitten by, well, actually owner's husband bitten by a Cocker Spaniel, and you know, dad tried to take the bone from him. He wasn't having it. So a bit of training needs to come into place, and if you are starting with a puppy, that's really easy to do. I always
Yes.
start with trading it for a hunk of meat, give the dog something of more value, make it a non-battle, and go from there. So I'm so glad
Well,
you said raw bones. Can we pop in for a question before we jump on to
sure.
dental cleaning? Because Janet had an excellent question. She has golden retrievers, as you can see from her picture, and they are in fact retrieving machines, mainly retrieving bumpers, and I'm assuming balls that will float in water as well as be on land. What are your thoughts?
Well, you have to be careful that they don't be too mouthy on them, because a lot of times when you're throwing them out for them to retrieve, they're getting dirt and that on there, and if they're constantly chewing on it, it's like sandpaper on their teeth, and it will wear the teeth down slowly. Once we get past the enamel, then the dentin will wear down fairly quickly, and we can get pulpal exposure. Or there's little tubules that go to the pulp, and those can get infected with bacteria and cause
Mhm.
the infection to the pulp. So
Yeah.
if there is, let's say, dentin exposure, personally, what I would always recommend in practice is actually putting a crown on those teeth, on the canine teeth, to protect them,
Mhm.
because then basically they'll last a lot longer than if you don't. And the animal may not seem to be in pain, but usually there is some degree of discomfort where there's basically dentin exposure.
Well, and
So,
drive and
so just
their drive to retrieve and everything will override a pain response during the time of retrieving.
yes. Well, that adrenaline rush
Yeah,
basically eliminates a lot of pain and discomfort. We know that from football players and that as well.
without a doubt. And, I would segue to, I see a lot of German shepherds that are rock carriers and rock chewers, and that's even worse because not only is that abrasive material, it's heavy, they're tossing it around their mouths, um, and those teeth just wear like you wouldn't believe.
Well, actually,
Um,
the worst is a tennis ball, because the
oh,
fibers
yes.
pick up dirt so easily, and it acts as that sandpaper. And so, if you're going to use a ball, I would say get actually, what I usually recommend is up here in Canada is to get a road hockey ball, because they're tough enough
Oh,
that the animal can chew them, but they're not tough enough to break
mhm.
them or break the teeth or that, and very little material accumulates on the ball itself, and they're easy to wash as well.
Yeah, I think we don't think about what's on the ball as much as we should, whether that's dirt or, pond water with scum, that's a potential disease risk. There's a lot of things that are going to stick to the ball.
Yes.
And as Diane points out, some of these tennis balls contain some toxins and stuff to try to make the fibers tougher or to provide the coloration. Uh, so Julianne has a question that leads us to our
Sure.
next topic, which is basically to discuss dental cleanings. So she has a Cavalier Clear of heart disease, congratulations, that's an accomplishment. And going for her first cleaning to be done by a fellow board certified veterinary dentist next month. She asked after that, it's not going to let us see that. Is there anything I can do to help her best prepare for the cleaning?
It depends on how good or bad the pet's mouth is. If there's a lot of inflammation, yes, there's a lot of things that can be done, just such as the product that's distributed by the company I work for, 1TDC, and Elite Science is an excellent product to reduce that inflammation and discomfort that the animals go through. And it's a great preventative for inflammation as well. Now, King Cavalier Spaniels are definitely predisposed genetically to dental disease because of a weakened immune system. And as a result, they're more commonly affected with dental disease. So some home care afterwards is essential. Before the procedure, the biggest thing is controlling inflammation. So it's an easier procedure, quicker, and as a result, cheaper for them as well. So using the 1TDC would be a very good idea to help decrease the inflammation. But once the teeth cleaning is performed and we have a nice healthy subject, you should wait about 2 minutes after, or 2 minutes, 2 weeks after the procedure, and then introduce a home care regime. A home care regime should be basically recommended by your veterinary dentist, your boarded dentist, or your veterinarian, as far as and they should customize it to meet not only your pet's needs, but your personal needs as well. Because not everybody can brush. Very few people can brush properly. It's the best thing. However, let's face it, most times only about 3% of the population brush their pets' teeth properly. But there's many, many other products out there that are just as effective at basically plaque control and calculus control as brushing. So a dental diet, use it as a treat instead of a diet. I found that worked very well. I that's what I do with my dogs. And basically for 14 years, I haven't had to do one teeth cleaning on them because it was controlled that way, and also with the 1TDC as well. So you could use that. You could use a water additive. There's a number of them out there. The best one I feel personally is a one called Healthy Mouth. It's a natural organic product and is 60%, 67% effective at reducing plaque accumulation on the dentition. And there's many, many other treats and stuff like that that are good for basically preventative care for dental periodontal disease. So wait till the mouth is clean and healthy to do those things, because if you start too early, the mouth may be sore and the animal may resent what you're doing. And as a result, basically, you want to start when there's a nice, healthy mouth that's pain-free.
Yeah, definitely, because who wouldn't avoid pain or situations that we perceive as causing pain? So, do you have like a few criteria that would be flags that your dog really needs a dental cleaning?
Yes,
Or
actually, we
re-
actually Elite Science and we created a dental report card that basically an owner at home can basically evaluate things and see if their
I
pet
love
has problems, and basically do we need to be seen right away or at a later date. I think you could show that. I'm not sure if you have it on there. So if we have it, that would be great.
Yeah, it's further, it's up in the
Because that way I
comments.
can
Just
just
scroll back.
describe it.
Yeah, just scroll back in the comments, everyone, and you'll see this link that I'm displaying that Diane has shared to the 1TDC dental report card. So how often would you have your owners fill out this report card or make these observations? Is this
I would
something
do
they
it
do
twice a
once
year.
a month?
Nope,
Twice
just
a year,
twice a
okay.
year. Twice a year.
Okay.
And, basically, if they're doing any home care, they're going to be looking at the mouth anyways and
Sure.
noticing that if there's problems. But this is a very simple thing to do, and how to find out if there's a problem. The first is you got to have a piece of gauze, like a gauze sponge.
Hmm.
You can get those anywhere.
Sure.
And what you would do, you got to have a cooperative patient. Okay, meaning the dog has got to be will let you go in his mouth. Otherwise, you could get bit, and if that's the case, we don't want you doing this. Okay, leave it for your veterinarian to examine and understand and do it. But most dogs will trust their odor impeccably, and it's usually a very simple thing to do. And what you do is just put this gauze around your finger, and then slip it underneath the lip and right on the gum line next to the teeth. You would do one wipe like this, top and bottom, and see what color is on there. If you see brown, that which is most common, that's plaque. Okay, so if you see that, it means that you need to do some plaque control. So home care and asking your veterinarian to customize a home care program for you and your pet. If you see blood there, that
Mm,
means you probably need some dental work. How much depends on the extensiveness of that
mm,
bleeding. Is it
yeah.
all over the whole mouth, or is it just one area, or what? So if you have blood, it means that your animal's in discomfort and it needs to be addressed. So
Yeah.
that's a criteria saying, yeah, we got to go to the vet now or
Yeah.
soon,
Pretty,
very soon.
pretty
And
soon. Yeah.
and if it's just plaque, well, you can try home care. And then a couple months down the road, try it again. And if you're still having problems, then maybe go to your vet and say, hey, I need your help here. How do we do home care for my
Hmm.
pet?
That makes a lot of
And
sense.
this report card, and the report card has basically a color coordination. So it says what to look for as far as that. And basically it says if the inflammation is either mild, moderate, or advanced, advanced means it's going to be bleeding. Simple as that. So you need to get something
Yeah.
done. Okay. And
Yeah.
as a result, it's a very simple way of evaluating. A lot of people have given dental pamphlets that tell about the grades of periodontal disease, how bad things are. Well, they're confusing and it's not easy to understand, where this is very easy and simple to understand.
Yeah. I think
And if they have,
veterinarians try to give a lot of information and grading, and it just gets so confusing. I love this elegant, simple approach. Just the
well,
colors and is
I
there
always
blood?
use the kiss symbol. Yeah, keep it
Mhm.
simple, because you know I like to think simply, and because 90% of the time it's can be simply solved, and it doesn't take brain science to resolve the problem. So as a result, keep it simple.
Keep it simple. So what exactly is entailed in a dental cleaning? Can you tell us how you
Well,
approach
the
them?
first thing, certainly, the first thing is you want to make sure that uh, we have to put them under to do a proper cleaning, because we
Yeah.
have to go beneath the gum line and scrape behind underneath the gum line. You can't do that with an awake animal. It's too dangerous for both the operator as well as the patient. And
Mhm.
as a result, the veterinarian needs to do a full physical on this animal and probably some testing to see if it's safe to go under an anesthetic. And if it's not, is there anything they can do to make it safe? A lot of times it's very simple. You have the animal ate. Well, we're not going to give that anesthetic today. We're going to wait till it's got an
Yeah.
empty stomach. Simple as that. But
Right.
if there's some heart disease or something like that, what degree of heart disease is it? Is it affecting the animal? Is it compromising the animal? Or is it just very at the very beginning stages and we're just catching it early, and you just have to monitor more carefully? That's all. So is there drugs that we can use to help, let's say, the liver be more stable, or that?
Mhm.
So what I would normally do is I would do a full physical. If I saw this a heart murmur or some abnormal sounds to the lungs, I'd ask for maybe an ultrasound or a chest x-ray. But at a minimum, what I would do is a comprehensive blood test, because that shows if any of the organs are compromised, and it says the degree that they're compromised. And it also tells you, can you do something to make it safer, it's more stable.
Right.
So it's a safer event. And as a result, you can be quicker and more efficient. And as a result, the animal wakes up faster and it's a safer procedure. There's no such thing as a safe anesthetic.
Hmm.
Bottom line is they're all calculated poisons.
Yeah.
And I
It's always
said
risk.
calculated. There's always a risk. And, things can go terribly wrong real fast. But fortunately, that's very, very rare. That, in fact, it's so rare that it's more dangerous statistically for the owner to drive their pet to the hospital than it is for them to go under the anesthetic. That's, if you put
Interesting.
it in reality, that's the truth.
Interesting. I'm gonna
But,
use that. I'm gonna use that.
well, it it's the truth.
I believe it.
It's one of those things where people get paranoid, because if something goes wrong, it's a disaster. And it's
Of
not
course.
just a disaster for the owner and pet, it's a disaster for the whole veterinary team. Uh, uh, I mean, it is very, very hard on everyone, everyone. And everybody tries their best, but sometimes something is going to happen. And, it's rare, but when it does happen, it's
Devastating.
very devastating.
And, we all think about, well, what if I did this differently or that differently? One of the most common things I run into in practice is people asking if their dog is too old to have a dental procedure. And that came to Janet's mind as well. What are your thoughts?
Yeah. Well, to me, old age is not a disease. You know, it means that there's some wear and tear on the body, and you got to find out if that wear and tear is going to affect the anesthetic in any way, shape, or form. And is there things that one can do to actually make it safer for the pet? And so, really, all what it's telling me is I just got to do a good oral exam, a good physical exam, and make sure that all the organs are functioning properly.
Yeah, appropriate blood work
So,
and chest X-ray if you have any doubt, cardiac
Mhm.
BNP. I mean, there's so many ways we can assess the body fully to be sure we're at minimum risk, but
and
it still can happen.
sometimes sometimes we have to take a risk because the quality of life for the patient is so poor that if we don't do something, we're just letting that animal suffer. And is
Mm,
that right? I don't think so. However, that's
yeah,
an ethical decision that
that's a
most
tough one
people
for
have
some
to
people.
figure out themselves.
Yeah, and
Yes,
I
very can be very
always
tough.
I always
The
lean towards I
veterinarian
wanna
can
go
help.
down swinging, but not everybody is of that mindset. Um, so
Exactly.
once you've done
So,
all your pre-anesthetic
and
workup and everything, and your dog's anesthetic risk and anesthetic plan are in place, what are you doing when you're going in there for a prophy, for a dental cleaning?
uh, the first thing that we do is we take full mouth x-rays. So in other words, as soon as they're under, we will actually, first of all, they're hooked up to intravenous, they're hooked up to fluids, they have some antibiotics online, just because we're going to create spread of bacteria through the body. And if the body's under anesthetic, it's a little bit compromised, and we don't want to have that bacteria lodging in any other organs or that. So we'll cover them with some antibiotics and basically get them stable, and then do full mouth x-rays. Full mouth x-rays tell us exactly what's going on with the mouth. Is it healthy, or is there a disease anywhere in that oral cavity? Now, there's a new machine out now called a cone beam CT that's even better than full mouth x-rays and more comprehensive in its evaluation of pathology of the oral cavity. And but again, it's a very, very expensive machine, and most veterinarians will not have that in their practice because of the expense, but they will have dental x-rays.
Mhm.
If the practice does not have dental
Mhm.
x-rays, I don't think I would even want my pet to be treated there for dentistry, because if you don't take x-rays, you're missing the whole boat. You're not doing a service for the pet nor to the owner of that pet. So we take x-rays. Then what we'll do is, while I'm looking at those x-rays, my technician who's trained on how to do superficial cleaning will clean basically the top part of the mouth,
Mhm.
and then I will do probing and, and evaluate the oral cavity, and we'll chart, and then we'll actually do subgingival scaling after that, cleaning beneath the gum line. So everything is clean, and we can start off with a good beginning. After the cleaning, what I do is I'll
Mhm.
rinse out the areas, and I'll dry it, and then I'll put on fluoride. I like fluoride because basically fluoride basically desensitizes teeth, it strengthens the enamel, and it has an antibacterial action and will last for a number of days on the tooth surface. It's
Mhm.
electrically bonded to the tooth surface and is slowly released over time. And as a result, while the animal is healing, it gives some protection to the gums. Now, a lot of people will say, well, there's a danger because of toxicity. Well, I've seen basically fluoride toxicosis in large animals in mine sites, but that was from mining, not from
Mhm.
dental disease. I have
Mhm.
never seen any toxicity from fluoride application in an animal ever. So, if used properly, there's virtually no danger at all for it.
Mhm.
And then we recover the animal, and basically we'll monitor it fully and then send it home, usually with some home care products to aid in the healing of the mouth and keeping basically the plaque under control, letting the gums heal. So we'll use something like chlorhexidine. We'll use a product like MaxiGuard, which is a zinc ascorbic acid
Sure.
product that helps produce collagen in the mouth. And basically, with dental disease, basically periodontal disease, the first tissue to be lost is collagen, so it aids in promoting and repair of that. TDC to reduce inflammation there, and as a result, basically create good oral health. And then I would ask them back to see them again in 2 weeks' time, and that is to evaluate how much healing we have in the mouth. And at that time, I would then normally customize a home care program that's
Mhm.
unique for them and their pet.
Yeah,
And then we
making
would
sure.
follow up afterwards about Mhm.
Yeah.
And it's a matter of knowing what they can do or not,
Mhm. And what if
and
there
what the pets
are
will
what if you
allow.
uncover some loose incisors or a tooth that's suspect and you do an extraction? What additional things are you doing post-extraction or during the extraction?
Well, what I normally do, since they come to me as a specialist, is I try to do everything at once, but when I'll ask them to make sure that they give me some numbers that I can reach them at, so that I
Right.
can talk to them about the pathology that's there, what options we have, and also the costs associated with those procedures.
Mhm.
So, and then let them make that decision. Now, they may not want to do it right away. They may want to do it at a later
Right.
date. Not everybody has that money, and they may want to save up. But you know, I would also inform them if their animal was suffering because of it or not. Is it something that we could buy to some time, or really we're going to let the animal suffer if we don't do it.
Yeah, yeah. And
So
I mean,
that's why
we've
it's
all
all important.
encountered those toy breed dogs that have incisors that you can practically pluck out with your fingers. Um, those are just terrible
Well,
for the poor dog. Oh
well,
gosh.
if you can
Um,
even get close because of the bad breath, and their breath is so horrible. Walk into the
Funny,
room and that there's a real problem here.
funny you mentioned stinky dog breath, as Janet is asking, do you give any advice to owners when they call you up on the phone, or your receptionist, when you were practicing? My dog's breath stinks. And anything you prep them on, where to look, what to consider, or do you have them come in for an
Well,
exam straight away?
most times it is due to dental disease. It's rare that it's actually due to intestinal upsets, and that it can be.
Hmm.
However, it's rare. And as a result, if
Yeah.
there's a bad foul smell, basically it's better to have the veterinarian take a look, because even if it's an intestinal upset, those are usually chronic situations that can be really helped a lot very simply and cheaply. And as a result, just an exam will be very, very helpful. And a lot of times, a lot of people will just put them on some medication initially, like one TDC, MaxiGuard, which also
Oops. Oh no. Oh guys, I am so sorry. Dr. Anthony is gone. Hopefully he will be back in just a minute. Um, come back, Dr. Anthony. Uh, so anyway, while he's finding his way back through cyberspace, I will tell you that we are going to be doing a one TDC giveaway, uh, 2 bottles. So we will have a comment for you to make so that you go into the lottery jar. There is also a discount code for one TDC, uh, that is HDE10. I'm not sure if it's active now or will be active later tonight, but it will get you 10% off any of your purchases at the Work So Well website, which one of my team will pop in. I'm just going to switch to email now. I've never had somebody exit so rapidly from the uh, the podcast, and he is not in there. So, wow, this is unfortunate. The code, Janet, is not 1TDC10, it's HDE10. Um, and yes, I'd love to talk about the benefits of 1TDC, but not without Dr. Anthony. I wonder if he even knows he's gone. We may have to bring him back. So, gee. So, I'm just going to type this in. Code is HDE10. Here he comes. Thank heavens. Okay, Dr. Anthony, I
there
don't
we
know. I don't know what happened. You just poofed and you were gone.
yeah, I've never had that happen before,
I've never
but
had that
I
happen
didn't touch
either.
it to the computer. Uh,
Well, I said
Technology at its best.
I said before we were on camera that normally all my tech difficulties happened on a Tuesday, which is why I've scheduled these lives for Wednesday and Friday. Evidently, Friday maybe jinxed as well. So we were just sharing the discount code for 10% off, and everybody's asking, tell us more about one TDC. So let's dive into the product because I've had amazing results with it. So
Well,
what it is, what it
I did
does.
the research. I did the research on this product, and I did the research to prove them wrong. I didn't believe in it. I thought it was, just
I love it.
not going to be effective at all. And I did the research, and when I got the statistics back, I called up one of the co-owners, Olivier, Mr. Moran, and I apologized to him. I told him that I did this because I didn't believe it was going to work. However, the product is not just good; it was excellent at preventing
Mhm.
inflammation for the gums. Now, technically, it's a nutraceutical, so they're not supposed to say that it does that, but I know it does as a veterinarian, and I've seen it, and I've done research to prove it. It does help tremendously with inflammation control, and not just the
And
mouth,
it's a fatty
elsewhere in the
acid,
body as
right?
well, for that matter.
Yeah,
Well, it's
using it for ACL
esterified
tears.
fatty acids.
Okay,
Yeah.
okay,
It is
explain.
esterified fatty acids. So basically, what fatty acids have basically a hydroxyl group at the end of the its chain, and what we do is we put an ester on there, and that changes its whole function to where it's rapidly absorbed and binds very quickly to what we call T helper cells. I'm getting a little bit scientific here, but T helper cells is a
Mhm,
white blood cell that goes throughout the body, and in areas of active inflammation, it releases the TDC, and the TDC then binds to damaged cells and goes into the cells and helps it repair it and stops the production of more inflammatory components that can cause the destructive mechanisms of tissue and bone loss, as well as going systemically and affecting other organs. Now, the big thing is with this product, it can be as rapidly absorbed, and that's why it also has a transdermal absorption. What that means is you can put
mm,
it on the skin and it's absorbed through
mm,
the skin. So those animals that basically are very, very painful in their mouth, let's say the cats with stomatitis or the dogs with cups, instead of putting it in the mouth and getting bit because it hurts so much, you could put it on the inside pinna of the ear, and you just put it
oh,
on, leave it on for 10
ah,
minutes, wipe it off. And within 10 minutes, 95% of it is absorbed already.
mhm,
So it's very, very
mhm,
easy to apply, but also the taste is so palatable. Dogs and cats love it. So it's
mhm,
getting owner compliance
mhm,
is not an issue because the animal looks at it like a treat. I mean, pets
yeah,
will actually sometimes
yeah,
remind you that it's time for the one TDC. And as a result, it's actually like a treat and works very, very
mhm,
well. And it's not just basically for, inflammation of the mouth, it's inflammation of the joints and other areas as well. It's just that the company hasn't done research on areas of other areas, but I can tell you from anecdotally that I've seen benefits in other areas of inflammatory conditions of the pet. And
yeah,
it's one of
as
those
my
things where,
client as my client and friend Claire Rossi, her 9-year-old dog is on one TDC, and teeth and joints,
right. Well,
definitely.
the biggest complaint that I've ever had with this product is that, on the recheck, when I came to look at his mouth, the mouth was excellent, but they said, well, we have a complaint about it. The dog's jumping up on the table, jumping up on the bed, waking me up in the morning, eating our food off the table. To me, if I get that type of complaint, I'm happy because it means that their joints are feeling better
Mhm,
and the dog is mobile. So it's one of those things that it doesn't happen overnight. It's not like a drug where you have NSAID or other anti-inflammatory like aspirin or whatever, where you give it and then 4 hours later it's basically already doing better. It takes a few days, and usually it takes about a good month before you see a real good benefit. You can, if you have an astute eye, in a couple of weeks you can see a good benefit. However, but it normally takes about most people about a month before they realize, oh yeah, the dog's jumping up and going up the stairs or whatever.
yeah, our Yorkie health people loving it. Uh, and 2 other great questions or comments. First,
Sure.
uh, using it proactively, which a lot of my people are about. What is it useful as a preventative for starting off with young dogs?
Absolutely. By reducing inflammation, basically it takes away any discomfort of the mouth And as a result, basically the animal can chew and naturally clean the plaque off their teeth from, let's say, a chew source or a dental treat or something like that, or dental diet as a treat. And as a result, preventatively, it works wonderful. Like I said earlier in the broadcast, I said that with my dogs, I gave them two things: one TDC and a dental diet as a treat, not as a diet. And as a result, I've never had to clean my dog's teeth. And like Janet, basically, I'm a golden retriever person as well. And my Goldens, I've never had to ever clean their teeth, not once. So, it does work preventatively. And let's face it doesn't mean that you should bring your pet in for an oral exam with your veterinarian. However, if it reduces basically an oral hygiene procedure, hey, that saves you a lot of money. And you can spend that money for more preventative products as well as more vacations and those types of things. And I'd rather see you do that than have the animal under an anesthetic getting a teeth cleaned. So being proactive, I'm all for it, 100% behind it.
Excellent. There are two questions. I'm going to just show Lori's because it happens to be where my cursor is. Are there any risks to long-term or overuse of one TDC? And Jean asked, any research studies on using it with dogs with underlying conditions such as kidney disease?
Okay. The answer is yes and yes. Is there a
Okay.
risk of long term? No, there's no risk at all. I probably have dispensed probably about 30,000
Mm-hmm.
bottles, and I haven't had one side effect, not one. And as a result, I've never seen a side effect. The only thing that we do recommend, and this is more of a precaution than actually it being basically something that's recommended, but rather being precautionary, is if you are on a fatty acid supplement already and you add TDC, we recommend that you reduce your fatty acid supplement by half.
Okay.
Just because too many fatty acids, even though these are esterified fatty acids and are totally different, can cause basically blood disorders. It can affect the platelets, and blood disorders could arise.
Mm-hmm.
So I'd rather be proactive and say, let's be proactive and just avoid things just to be on the safe side. So as far as safety, it's a very safe and compatible product with all products. The only time that I would not use TDC orally is if we have a dog or cat that is actively vomiting or has chronic active pancreatitis. Then I would put it in the ear,
Mm-hmm.
and it will help. It will help with that because it will help reduce some of the inflammatory components.
Yeah.
The second question was, uh, can
Second
you
question
increase
was
the dose?
underlying disorders such as kidney diseases.
Okay, for kidney diseases, like I said, the only one that I would be cautionary about is basically giving it orally for a dog or cat that is vomiting, actively vomiting, or has a tendency for chronic active pancreatitis. Otherwise, kidney disease, liver disease, uh,
Cancer?
even chronic bowel disease. Pardon me,
Cancer?
cancer, no problem.
Okay.
With
Um,
cancer, there is another product that the TD or Elite Science has that actually is quite good for cancer, and that is IP6. It's insulin, and it is. There's a lot of research, and you can look at the website and look at the research on it and whatnot. It helps. Is there a cure? Does it cure it? No. The answer
no,
is no.
no.
And I mean, one TDC is a great product, but it's not a miracle drug. I mean,
Right. It's
there's
a
limitations
help.
to everything.
Yeah.
Yes.
And when you're saying adjust your fatty acid supplementation, you're speaking largely of omega 3s, fish oils, salmon oil,
Yes.
krill oil.
Correct.
Okay. Just to
Yes.
clarify for one more person. And before we do our giveaway, um, one more question. And that's from Linda. Does rubbing it on the gums also help joints? Now, I'm familiar with Susan Garrett, who's also a friend, and she was applying
Yes,
it topically to the joint. Can you speak briefly on that?
sure. Basically, if you apply it to the active site of inflammation, basically you're going to get more of the active ingredient at the area you want it. However, so with the mouth, if you apply it to the gums, if it's gum inflammation, well, it's right there, and you get more of the active ingredient there helping.
Mhm.
However, if you put it to the ear, it has to circulate through the whole body. And if there's other areas of the body that have inflammation, there's going to be a dilution effect. Okay, so you may not get as much as
Mhm.
you need there. And you could always double the dose for the first month just to be on the safe side to get to basically enough to the active sites.
That makes sense. That makes sense. So we've already told you guys about the discount code. So if you go to the Work So Well website and type in HDE10, you will get a 10% discount. But now we're going to give away 2 bottles of 1 TDC. So we're going to try the new widget that my software just gave us. And if you type in, what shall we say? Should we use the code word teeth, or you want 1 TDC?
Or just, yeah, I think basically talking about home care, just home care.
Home care. Okay, home care. That's it. So let me go to my widget and activate the lottery jar. And let's see what we've got. Reset. So guys, type in home care and let's see what happens. Okay. I can't tell who you are who are popping in there, but you'll see, I see different people's uh, logos, whatever they are, popping in there. Oh, okay, I see Claire. So we'll give everybody a shot and then we'll get a couple winners. And I think you will have to reach out to me with your address so I can arrange to get things to you. So we will give that a couple minutes or a minute or two. Let's see the other questions that we missed. In the meantime, get your tickets for the Healthy Dog Expo, healthydogexpo.com, where Olivier will be there in the 1 TDC table, answering your questions, being there with product and information. So you can actually talk to the man behind the brand. I don't know, Dr. Anthony, if he's going to convince you to try to come down from Canada, but it will be warmer in April in Albany. We also have some amazing speakers, a huge number of new sponsors, people you've not heard from yet, new faces. It's going to be really exciting. And we have the VIP program where you will get extra workshops and hands-on workshops with the animal diet formulator, with Rita Hogan making herbs. You'll get your hands dirty with green plants. It's going to be a lot of fun. So I think we've got everybody in here. So shall we get a winner? Let's see if it works. Oh, come on. Get a winner. Diane, you won. Okay. And we'll get one more. Claire. Oh my God, 2 people I know. So you guys know how to get to me. Isn't it fabulous? The little lottery jar worked. So
It's actually a neat
yeah,
event.
this is great. So winners, Diane and Claire, message me. And we'll arrange to get things in there. Get things to you, I should say. So thank you so much, Dr. Anthony. I know we've taken
You're
more of
very
your time than I
no,
asked you for, and I do
anytime.
appreciate it, as do all of my guests. And guys, please share this broadcast. with people. People are always asking about replays. If it shows up on their feed, they'll get it before they have to rely on me to say, yes, go to the replay. So thank you
I'll just,
all. This
can I
has been,
mention one last thing?
of course, of course.
And that, thank you. There is an equivalent human product
Oh,
uh, that
excellent.
basically can be used for yourselves if you have any joint pain or basically for periodontal disease. I mean, personally, I used to have periodontal pockets that were 8 millimeters deep. Now I don't have any abnormal pockets
That's
since I've been
great.
using it.
Mhm.
So as a result, it does work on humans as well. It's a very safe product for humans, and basically, to be honest with you, I use the veterinary one. I don't
I knew
bark
it.
at because of it, but it's the veterinary one is a little bit stronger and it's cheaper, so that's why I use the veterinary one. But don't tell Olivier
We
that.
won't
That's
tell.
our secret.
We won't tell. And you're not the only one.
That's great.
So yeah, so they can get that at the Work So Well website as well, if they prefer the
Yes,
human strength, and get your
yes.
discount. It's a win-win.
Mhm.
So this has just been awesome. I can't tell you thank you enough, and I will
A pleasure.
see I will see all of you guys back on next Wednesday with Julianne Lee of Adored Beast Apothecary, who is also making the trip down from Canada to be with us at the expo. So she will be there live as well as on broadcast next week. So, guys, have an awesome weekend, and you as well, Dr. Anthony, and we
Thank
will
you,
see you soon. Bye for now.
and good luck with home care.
Yes, definitely. Take care, everyone.
Take care.